we're gonna demonstrate the taping of the knee. So we take these Coverall Stretch pieces of tape that we've already cut. This is the Coverall Stretch. We'll put the link in the description. And we cut it to like 4.5 squares for this patient's knee. When you wanna measure the length of the taping, you wanna make sure that you can curve the tape around the knee, okay? So it's plenty of length. Some people will use 5 squares, some people will use 4 squares. Again, the line here delineates the squares. So we want to start with a pre-alcoholed leg. Alcohol just helps to decrease all the oils and make the tape last longer and stick longer. Then we feel the kneecap, and there's a kneecap right here. So we curve around the kneecap on the outside, and then we do the around the kneecap on the inside. And these pieces always just fall to the floor. You can pick them up later because, you know, you want to focus on not letting this tape stick to itself. You want it to have be as flat as possible. So we're curving it around, and this is the white tape. This is the protection for the skin. Then we follow that with Elasticon. We do. Yeah, so the Elasticon is a little bit more elasticy, a little bit more stretchy than the Leukotape because we want to allow the knee to be able to bend. Notice that we start with taping at the 90-degree position because that enables the knee to be able to bend when walking. You're going to want to use this Elasticon throughout the time frame of your athletics after your regenerative medicine procedure for 8 to 12 weeks. Will you help me hold this, please? You can have your patient help you so that you can have the good taut tape when you cut it. You cut it right down where it meets the white tape. Notice it bounces back because it's stretchy. Take your 2 fingers. You're going to start by cutting up the line, and then you're going to peel the rest. Okay, so then you can go with one hand first and curve it around and tack it down hard. And then you go with the other side. Curve it around, and I'm pulling pretty hard so that it gives a nice hug or customized brace for that knee. This tape works very well for quad tendon tears, patellar tendon tears, as well as hugging the knee and keeping it kind of stable while the regenerative medicine is working. So meniscus tears, even, you know, different ligament tears can benefit from this knee taping. We want to finish off the job by putting some pieces on top of the Elasticon that hold the Elasticon in place so it doesn't rub up or roll down when you're putting pants or shorts on and off. And the Elasticon looks like this. It's made by Johnson & Johnson, and I believe this is about 3 inches in width. We can put the links for purchase in the description. All right, this can stay on for 1 week, and if it comes off sooner, you can retape it. If it gets rashy or irritated or little bumps of red, give it a couple days of rest and clean off the knee with soap and water and then try to retape again. You can also continue this tape for at least 8 weeks after the regenerative medicine procedure. Most people will tape it again in between workouts. If they get really sweaty, they can take it off and repeat it. Or if you're taking more light and easy, you can leave it on for 7 days. Okay, thanks.